现如今，心脏疾病不再是年长者的通病，年轻人患上心脏疾病的几率也越来越高。心脏作为我们人体最主要的器官之一，你又对自己的心脏有多了解呢？在面对紧急情况发生时，我们又能采取什么样的措施？你是否能辨别你自己的心脏是否健康吗？我们一起去询问医生吧。
Good morning, ciao an everyone. My name is Dr. Suhailan. I am the emergency physician in Institut Jantung Negara, and I'll be happy to answer any questions today regarding heart emergencies or heart attack. Signs of heart emergency or heart attack, there are the common signs, which is the typical sign. Sign normally chest pain. If you have chest pain, normally it's in the middle of the chest. Tapi any chest pain might be a sign of a heart attack. Yeah? Especially if the chest pain ni associated with sweating. Rules, kalau sweating, they feel nauseated, and if they feel a shortness of breath. Katakan we are sitting here and suddenly I have chest pain, that might be a heart attack. But normally people with heart attack, they have chest pain which persist, and probably will go away when they rest, but sometimes it will go on continuously. So that are the typical signs. What they have is not chest pain, but they have epigastric pain, pain in the middle, pain between your chest and your abdomen, your tummy. So it's very important. If you have chest pain, gastric pain, please get your self-checked. For example, one of your relatives seems to have a chest pain and he says or she says, I am a heart patient. So it's important for us to make sure the patient is safe. So sit them down. Because the heart might stop and they collapse and they might fall. You know the patient, you know the history. Sometimes you can ask, what medication do you normally take? One medication that we take during a heart attack, we call it sublingual GTN. That will decrease the pain or it might stop the pain totally. And number 3, you need to call help. So you need to call the ambulance. So you have to know what number to call, and an ambulance will come to you and they'll bring the patient to a government hospital, or maybe a hospital you want to go to. You have to know their ambulance number or a private ambulance number. What we understand, what involves in CPR is, if you watch TV, we are compressing the chest. So that is one of the elements of CPR. Are there different kinds of CPR? Yes, we are. It's different in adults. It's different in children, and it's different in babies, or we call them neonate, less than 1 year. Now, what's different is if adult, we use 2 hands, 2 hand CPR, and we push fast, 100 push a minute. You have to push at least 5 centimeter. Maximum is 6 centimeter. In children, we are using only 1 hand because of the smaller size, but the rate is the same. The depth is different because adult chest is thicker, children chest is not so thick. So we go 1/3 of the depth of the chest. Now in IJN, we are open 24 hours, 7 days a week, and open throughout the year. We have experienced cardiologists, we have experienced cardiothoracic surgeon, we also have vascular surgeon, and normally patient with heart attack, they will have problem with the kidneys. We have a nephrologist. We also have a respiratory physician, and normally these patients have diabetes, so we actually have an endocrinologist in IJN. So we have a lot of specialties just to take care of a patient having a heart attack. So what causes this blockage? There are factors which we can control, for example, hypertension. So if you have hypertension, high blood pressure, if you have diabetes, that can affect the blood vessel, causing blockage. If your cholesterol is very high, especially your LDL cholesterol, your bad cholesterol is high, that can affect the blood vessel. It can be blocked. Stress can affect you in terms of having a heart attack. If you're a smoker, all the chemicals will actually damage your blood vessels around the heart. That also contributes to having a heart attack. Those are the things which we can control, but there are also risk factors you cannot adjust. For example, males get more heart attack than females. You can't age. The older you get, the higher your risk of having a heart attack. And also in your family, if you have a family history of heart disease, you are at risk of having a heart attack. Patient having a panic attack will have chest pain. They will have shortness of breath. They might get numbness of the arm in panic attack, which is similar to chest pain, which is similar to a heart attack. Whether it's a panic attack or a heart attack, I assume it's a heart attack first. correct? Because heart attack is more serious than panic attack. So we will work them up for heart attack first. What do? We have to do an ECG. If the ECG is a massive heart attack, then you know it's a heart attack. But sometimes ECG can be normal. There are certain blood tests which can detect whether you're having a massive heart attack or not. And let's say both of these are normal, we still observe the patient for a few hours, and sometimes we do serial ECG. We repeat the ECG again, and also we repeat the blood test again. Normally, after a few hours, we can sort them out. And if you have a heart attack and you come to IJN, to the emergency department, first of all, we will do an ECG as fast as possible. You will be given priority. So let's say there's 10 people in front of you, you're number 10, but because you have a chest pain, you will be brought forward. So we will give you two medications in emergency department to thin your blood. Number one, we will try to stabilize you, and we will call the cardiology team to come down. So in IJN, we have cardiologists, very experienced. They can actually do difficult coronary angiogram, difficult coronary angioplasty. When they're having a heart attack, the vessels around the heart has a clot, so we have to dissolve that clot. It can be done mechanically. We suck it out and we put a coronary angiogram, we put a stent, or we can give medication to dissolve it, and that can be done in the emergency department. But if the lesion or the blockage is too extensive, they have a cardiothoracic surgeon to assist, and that's when the patient will be worked up for bypass, the term coronary artery bypass, CABG. So that's also available in IJN. And all this is available 24 hours throughout the year. In IJN, we also have networking. We have a collaboration with the First Ambulance. If you have a heart attack at home, you can call this number, the First Ambulance number. They will go to you, they will assess you. So they'll do an ECG in your house, and they will send the ECG to IJN. If it's a major heart attack, we can activate the team. By the time the patient arrives to the emergency department, everyone is ready. So that's how we make things very smooth and very fast, because remember, the door to balloon, from the time you enter, from the time we balloon that block, we have 90 minutes, but in IJN it's 54 minutes because of these small tweaking and improvement in procedures that we did.
经过医生的讲解，想必观众们也对自己的心脏有了更多的认识，也会更加保护自己的心脏。我们呢，在下一期将会有一场直播，如果你有什么疑惑的话，都能在直播上直接询问医师的解答。记得要关注东方日报，并且按赞、留言以及分享我们这次影片。我们这期节目就到这里啦，我们直播见。